Hello, everyone. I'm Giza Lopez. I am the Executive Director of the New York State Youth Justice Institute. The month of November invites us to center gratitude in everything that we do. So I want to start by thanking you for choosing to spend the next hour with us here at this Lunch and Learn webinar. I want to continue to center that gratitude and thank our sponsors and partners in the state, the University at Albany, DCJS, the Division of Criminal Justice Services, OCFS, the Office of Children and Family Services, as well as the New York State JJAG. Thank you to all of them. Without their support, it wouldn't be possible for us to be here today. All of our Lunch and Learns are very special. I learn a lot from the presenters, and I learn a lot from your questions. But today is a little bit extra in that I get to invite my longtime friend, Maria Tcherni-Buzzeo, to join me here on the screen and present the next hour of incredible research work that she's been doing. I am sure I'm going to learn a lot from her, and I look forward to seeing your questions in the Q&A. I have one housekeeping item before I pass the baton on to our amazing Alicia May, who will be moderating the conversation. And the housekeeping item is the YJI is growing and we are hiring. In fact, right now we have a job posting open for a senior research associate here at the YJI in Albany. We hope that you will consider applying if you match the description and have an interest. And if not, we hope very much that you will help us spread the word. Thank you. With that, Maria, welcome to the screen. And Alicia, the floor is yours. Thank you both.
Hi, thank you, Giza. Hello, everyone. Welcome to the Youth Justice Institute's Lunch and Learn webinar series. As Jesus said, my name is Alicia May, and I am the Research and Evaluation Specialist for the YJI. It is my pleasure today to introduce Dr. Maria Tcherni-Buzzeo. She is a professor and director of the Ph.D. program in criminal justice at the University of New Haven. She received her Ph.D. in criminal justice from the University at Albany, SUNY. Her research delves into crime trends and patterns, juvenile delinquency, and the influence of poverty and education on violent crime. She further explores how family dynamics, especially child abuse and neglect, intersect with biosocial factors such as mental health in precipitating violent offenses. We're excited for her to lead today's discussion on reducing youth violence through child mental health. Without further ado, Dr. Tcherni-Buzzeo.
Thank you, Alicia. Thank you, Giza. Thank you, everybody, for attending this webinar. And I really appreciate New York Youth Justice Institute for inviting me. This is a very exciting opportunity on a topic that's very close to my heart and the topic of my research. So let me share my screen with you. This is the presentation topic that I will be talking about. And I want to warn you right away. I will be talking about reducing juvenile violence through focus on child mental health, but it's going to be a very bird's eye view look of things, not like, say, close up and personal look at what's happening, but looking at the scope of the country, scope of the states, and how things change over time. So before we dive into the nitty-gritty of the topics, I want to have a little kind of like warm up for us, and I want you to tell us what your favorite Thanksgiving foods are. You can enter up to 3 options. Thanksgiving is coming up. I feel like this is a wonderful holiday and an opportunity to get together with friends and family and eat something yummy and not worry about presents. So please scan the QR code or go to the link in the chat or go to menti.com and enter the numbers that you see on the screen, 7612-2465. And it will bring you to the poll. And I can show you what we have so far. as your answers are coming in, we can see those people who put more votes for specific foods. Those foods are showing up in a larger font. So far we have mashed potatoes, stuffing, and turkey competing for the first place. And pumpkin pie seems not that far behind. Sweet potatoes, turkey, stuffing, mashed potatoes, cranberry sauces coming up. Okay, pecan pie. Very exciting. Thank you for your answers to this poll. And I'm going to have 2 more questions for you throughout the presentation. So I will use the same poll link and will just ask you to refresh it when we will have a question about the topic of today's presentation. So the first thing that I wanted to talk to you about is what is happening with violent crime and juvenile violence. It kind of like tracks this trend very clearly. So this is from the FBI Crime Data Explorer tool, and it shows how violent crime offenses have come down a lot since the early 1990s. So for the last 30 years or so, we had a huge decrease in violence in the country overall, but also in most areas too. And to show you maybe even like a more zoomed out look at what's been happening with violent crime trends, this is the estimates of homicide rates, because homicide is the type of violent crime that is easiest to kind of keep track of over time. From about the 1700s into this century, homicide rates have been decreasing. So this is a good illustration for what Steven Pinker talked about in his book, The Better Angels of Our Nature, how violence has declined. So I think it's really important to keep this in mind, especially when we're hearing from, like, say, evening news. We hear about something that happened and it makes us feel like maybe not as safe. I think these are like good trends to keep in mind, how much violence has declined in the last 300 years and in the last 30 years too. And now I have my next question to you. So what you can do is you can refresh the link and or scan the barcode again, or enter the same exact number on menti.com, 76122465. Just refresh or reload the poll link. And my question for you is, do you think poverty and crime are related? So we talked about violent crime trends and the decreases. And next is the poverty trends. And so here are the answers coming in to the poll. And we see that the vast majority of respondents, those who are watching this webinar now, are saying that poverty and crime are related. And there are some people who are not sure. And one brave person said no. And that's okay too. And here is why. I think this is an interesting and kind of counterintuitive thing that that often is overlooked when we think about the connection between poverty and crime. And it's that poverty is mostly related to violent crime, not to any crime, not to property crime. So if you think about it, the picture that we often have in our heads is that there is like, say, person in poverty who doesn't have enough money to feed their family, and they go and steal something from the store to do that. This is a very rare occasion. in modern times in countries with a solid safety net in the form of welfare, SNAP, and so on. And so we don't really see the connection between poverty and property crime. So it turns out that things like shoplifting, theft, fraud, they are committed by people of various income levels at about the same time. At the same time, when we think about violent crime, so like this is a graph that is based on homicide data, and so what it shows is each dot here is a county. So we have the level of poverty in the county from census data and the homicide rate for that county, and that's where we place each dot. And so you see there is a very clear trend that counties that have a higher percentage of people in poverty, living in poverty, they have a higher rate of violent crime and homicide. So let's look at child poverty trends. And this is why that is important, is that it's not falling into poverty in adulthood that matters. As we saw during the 2008 crisis, a lot of people fell on hard times, but crime barely changed during the 2008, 2010, and subsequent years. And it actually is growing up in poverty as a child that makes the biggest difference based on research. And so here we see a really positive trends in terms of child poverty reductions. At the level of the whole country, we have poverty going down from about more than a quarter of the nation's kids in 1980s to about 10% in the last few years. And I also added data from for New York here so that you could see how New York kind of like measures up compared to the rest of the country. So the numbers are a little higher. So poverty goes down from about upper 20 percentile, around 30% in the mid 1980s to currently just under 14%. Again, that's for child poverty. Okay, and these are all the good news I have for you. No, I'm just kidding. I actually, I have some good news, but they come later. For now, we're going to talk about some tough things. And some tough things are the connection between mental health and crime. And I'm not even going to ask this question because this connection is fairly obvious. And I put on the screen the snapshot from a recent article from the Hartford Courant, and it's called De facto institutions. In Connecticut, 95.5% of prison inmates have mental illness history. And that's a report of the Connecticut Sentencing Commission that was completed a few months ago. And I expect that New York State is not very different from Connecticut in terms of its prison population. And so mental health is a huge issue for not only people who are in prison, but also people involved at other levels with the criminal justice system, right? People on probation, people on parole, people who are released from prison. And so the kind of like thinking of how it translates into mental health for youth, I thought it would be very interesting to see the changes in youth mental health. And this graph is from the National Institute of Healthcare Management. And it shows that from about 2010 for the next 10 years, we have a fairly drastic increase in the rate of mental illness among 18 to 25-year-old youth, whereas mental health issues for people in other age ranges are not as not as changing not as drastically. There are slight increases. And looking further into these trends, this is the trend based on data from the Youth Risk Behavior Survey. It's a huge survey that asks questions from high school students about their various experiences and behaviors. The CDC conducts this survey every other year. And so what this report shows is that from 2011 to 2021, the percentage of high school students who say that they're experiencing persistent feelings of sadness and hopelessness during the past year went up a lot. And we see here the difference between males and females. So for males, the proportion of people experiencing sadness and hopelessness went from 21% to 29%. And for females, it went from 36% to 57%. So my next question for you is, again, we're going to use the Mentimeter poll, is, do you think that challenges that today's youth face are different compared to the ones that they experienced, like, say, 10 or 20 years ago, or those who were youth 10 or 20 years ago experienced? Again, you can scan the QR code to go to the poll. You can refresh or reload the poll link. I'll go to menti.com and enter the code 76122465, or click the link in the chat.
And Maria, we just had a quick question. What age group of youth are we talking about here?
Yeah, so that is an excellent question. Let's think of adolescents, because that probably is the easiest group to think about, because when we think of children, it could be anybody from 0 to 21, right? So let's think of adolescents when we're thinking of challenges. So these are the answers that are coming in. And we have social media and cyberbullying featuring prominently among the answers. You are also saying that isolation and drugs are issues that are important. Peer pressure. Okay, so these are the answers. We also see effects of COVID among the answers. And internet and news, climate change, technology exposure, school shootings. These are all very important considerations. Gun violence. So thank you for your answers. And what I'm going to show you today is that the trend in terms of like mental health, increasing mental health issues, it actually started even earlier than we are seeing in that graph that I previously showed. So this is a graph that shows the increases in diagnoses of bipolar disorder among youth and adults, and that increase happened from about mid-90s to mid-2000s. There was a drastic increase. So research shows that antipsychotic drug prescriptions for children and adolescents increased 7 times during that time. And when I talk about psychotropic medications for kids, these are medications for mental health conditions, right? And there were a lot of developments in psychotropic medications. And so These are the newer generation psychotropic medications. So what else is interesting is that the most common diagnosis for prescribing antipsychotic medication is disruptive behavior disorder, which is a disorder that just based on its name, it's clear that kids who have issues of this kind are the ones who are more likely to engage in aggressive behavior. And the numbers that we have from 2011 is that about 10% of children and adolescents were taking psychotropic medications, and it didn't change much. So it's still about 10 to 12% for children and adolescents. And my good friend and mentor, Dr. David Finkelhor from the University of New Hampshire, he published several articles with his colleagues kind of like outlining how psychotropic drugs may explain the decrease in juvenile violence. And they talk about reduced impulsive and risk-taking behaviors that wouldn't be possible for a lot of these children without the help of psychotropic drugs, and improved family relationships, and more effective parenting involvement when children are easier to manage, again, thanks to the effect of these drugs. And that was a huge inspiration for my own research, because even though I don't like the idea of drugging our kids as a solution to juvenile violence, I also have to think about it as a researcher. If something is happening in reality, I cannot just close my eyes to it and pretend it's not happening because I don't like the implications, right? So I try to approach this issue with an open mind, kind of like mindset, and think about it as something that we need to investigate. And so what I found out is, when I was preparing for my kind of like research project on this topic, was that there were several legislative changes that happened in the 1990s that expanded coverage, federal coverage for low-income families whose children got diagnosed with psychiatric conditions and prescribed psychotropic medication. That was, those were the points of a huge increase in the percentages of children diagnosed. And moreover, in most states, this also would automatically qualify the whole family for Medicaid coverage, and that created more incentives. You might have heard of, like, say, some scandals about like how some states tried to like take advantage of this and actually shift more families from state to federal roles, health insurance roles, through this mechanism. Another important set of legislative changes concerns education, and this is where we are moving from mental health kind of like issues or mental health / medication issues to the issues of school services for children with disabilities. So we had the No Child Left Behind Act that was passed in 2001, and it changed the rules of school accountability and how schools are accountable for the test scores of their children. You probably have heard a lot of criticism for that law. And then in 2004, there was Individuals with Disabilities Education Improvement Act, IDEA, it's called IDEA Act, where children with disabilities and learning disabilities, for example, children who got diagnosed with the attention deficit hyperactivity disorder and other learning disabilities, and especially the ones who got prescribed psychotropic medications, they could be excluded from the calculation of school averages. And as a result, many school administrators were kind of like pushed to do that because of that pressure that No Child Left Behind provided. And you might have heard about the ADHD explosion book written by Hinshaw and Scheffler in 2014 that talks about it, and also about the laws that some states passed pushing back against this trend and prohibiting school personnel from mentioning ADHD or possible ADHD diagnosis to parents of kids who had some issues. So those are important considerations, and those are some possible negative impacts. At the same time, it's important to keep in mind that we don't know what the true incidence of ADHD among children is. So we cannot say that children are overdiagnosed, because it is possible that they were underdiagnosed, like say earlier, right? And this legislative changes just created more mechanisms for them to seek the diagnoses that are legitimate. And another good consequence of this 2004 IDEA law was that each year since 2004, more children with disabilities are receiving additional services in schools, according to the US Department of Education. And there is a special emphasis on inclusion. And so, like, for example, in 2019, the data from the US Department of Education was that over 90% of children with disabilities are included into general classrooms for most of their days. And so these are, as I see them, positive trends, right? So, at the same time, the share of students with disabilities varies a lot among states, and the pace at which these changes are happening, right? So, like, say, let me show you the map. This is a map from the Department of Education that shows what percentage of students ages 3 to 21 are served under the Individuals with Disabilities Education Act as a percentage of public school enrollment. And so the average for the United States is 15%, and some states have a higher percentage of students with disabilities served under the IDEA law, and other states have lower percentages. So like New York is up there, along with some other states in the Northeast, where 20% of students are served, and then also in states outside of Northeast, Indiana, Wyoming, and New Mexico are also up there. And some other states, like, for example, Texas is an example of where there is a much lower percentage of students served, like, say, 12%, and the same for Colorado. Okay, so now I'm just gonna quickly explain what my own research is, because the interest that I had, again, trying to see if psychotropic drug prescribing to children and adolescents versus school-based services for children with disabilities matter the most for, like, say, consequences in terms of aggression and violence. And I used several types of consequences in terms of fighting, weapon carrying, homicides by youth. And I estimated how changes in drug prescribing and changes in the percentage of students served by state over time. So comparing states and comparing each state to itself over time, how it lines up with violent outcomes. And I looked at outcomes not only the same year, but also 3 years later, 5 years later, 7 years later. And the main more details can be found in the article that got recently published, kind of outlining this research. But this is like a really complicated project in terms of methodology, so I'm not gonna spend too much time on that. I'll just focus on the results. And the results were that psychotropic drug prescribing and juvenile violence have no clear associations. So now I cannot be called a pharma bro and calling for drugging our kids. But this is not to say that there is no impact. It is just that in my research project, I was not able to find the clear impact of this specific like say variable over time or between states. But what I did find was that increases in school-based services to children with disabilities are hugely influential. So influential because they lead to declines in minor and moderate forms of juvenile violence, both immediately, so the same year, and several years into the future. And the same with reducing child poverty. So those states where we see deeper reductions in child poverty, those are the states that also see deeper reductions in juvenile violence, all kinds of violence, and also that works over time. So this impact stays kind of like long lasting, and it works over time. And so what I think is really important thinking about it is that legislative changes and like say things that states can do to improve the situation and decrease juvenile violence, they are mainly looking at school-based services for children with disabilities, like kind of like making a more inclusive school environment and reducing child poverty. And these are basically my takeaways, and I'm looking forward to hearing your questions and responding to them. Thank you.
Right. Thank you, Maria. That was an awesome presentation. We have several questions. I'm really looking forward to this conversation. We wanted to ask you to start to ask, what extent does research on this topic interplay between school-based supports and mediation? And can this also take into account natural maturing processes, such as adolescent brain development? So youth are just getting older as a natural process. What role does that have?
Right. That is a great question. And what is happening, research shows that most of the school-based involvements are actually happening. So like say, most money spent under this IDEA Act is actually spent on younger kids. And so it seems like that is a hugely important factor, that younger kids are helped and kind of like wrapped in with services. And then another kind of like a consideration is that oftentimes medication, right, like psychotropic medications and school-based services are happening for the same kids, right? And it is only this individual level research when we can like track each kid over time and see like say what is happening when this kid like say is not taking medications, or when school services are discontinued. That's when we can see the difference in terms of like what matters, right? But unfortunately, in the United States, this type of research is essentially impossible because of privacy considerations, right? And even in other countries, like countries like, for example, Sweden, where they have those registers, population registers, that keep track of each person in terms of like everything important, in terms of their like schooling, in terms of their medication, diagnosis, their criminal justice system involvement. Even in those countries, research mostly looks at adults. They don't look at kids. But the research that exists on adults, it shows that psychotropic medications do matter a lot. And while people are taking them, they're much less likely to say reoffend.
Really fascinating. You briefly talked about this, but I'm curious if you could expand a little bit more about the impact of the age of diagnosis and the start of the supports. And we also had a question, could you elaborate a little bit about what those supports are, like the school-based supports, if you could give a couple of examples of those? For example, does it matter if those start really early, or is it okay? Like, how does it impact when it's different timing?
Right, right, and this is an excellent question, and I would love to know the answer too. So unfortunately, I can only give an answer based on my hunch and my understanding of the process, but I cannot give an answer based on my research, because my research is looking at states, right? And so what is happening at the state level, and the data that I have are for all children from age 3 to age 21, and what's been happening, like say, for school services with them. Some examples that the Department of Education is giving is how kids are more involved in classrooms, in general classrooms. They're not being separated. Like for example, you might have heard of stories how kids with disabilities were being just warehoused in a separate room and shown like movies all day long, right? And or cartoons. And this is not the type of services that like that are meant by the Department of Education under this IDEA Act. And so what's also really interesting to think about, not only the age, and again, my hunch is that the earlier probably the more impactful, but also the question of what is it about, like, say, those school-based services? Is it that the kids with learning disabilities themselves are more able to kind of like build social connections and become less aggressive, become less likely to kind of like graduate to things like juvenile violence? Or is it that wrapping them into general classrooms creates a situation of a general tolerance, understanding, and kind of like ability of normal kids to interact with, like, say, kids with disabilities, kids with problems, kids with various issues that before could have been dismissed as like, oh, this kid is just like not good. But now there is more understanding of how, like, say, developmental and brain processes affect, like, say, different people. And so I feel like that is an influential factor, but again, I cannot separate it. So it would be really interesting to see, again, an individual level research.
Yeah, you had mentioned in your presentation how like it has a relation to inclusion and how inclusion is really important here. And so that mainstreaming of and students in the general population is what it sounds like you're saying.
Right. So is it this increasing tolerance that essentially like is a more civilizing influence on everybody, right? That's the question.
There's another audience question here that's related to this. So there's a strong concern about overdiagnosis or misdiagnosis of conditions, specifically like ADHD or bipolar disorder. And you mentioned that we don't know the correct baseline information, like the prevalence rates from other generations. Can you speak more about these concerns?
Yeah, that is a very good question, and a really important one to consider, because as many parents can testify, like, say, when their kid is like, I think it is especially relevant for boys, like, say, when their son is like 5, it's very different from when he is 6 or 7 or 8 in terms of his ability to stay still, to focus on a task, to like, say, not do like things that he's not supposed to be doing, right? Whether at home or at school. And so is it really ADHD, or is it that this kid just needs more stimulation, more ability to run around, and it's too early for this kid to start schooling, right? And that's a question that should be kind of like if not decided, or at least debated at the national level. And I also understand that the United States in this sense is different from other developed countries, where in Europe, in many countries, schooling starts from the age of 7, not from the age of 5 like here. And it also is connected to the social safety net, right? Because here, childcare is really expensive. And so when parents are able to finally send their kid to school when he is, say, 5, even if it's too early for the kid, but parents just like cannot keep paying like the insane amounts of money that it costs to keep the kid in the daycare. So there are a lot of kind of like connected issues, and it's really hard to like separate them when deciding like what is a normal thing for like a child of this age, and also how can we make sure that the child is able to be in school and, like not be disruptive, and for that schooling to be effective.
Yeah, and it's so fascinating. This leads into our next question exactly. We wanted to know if you could speak to the intersections of these different identities, specifically race and ethnicity and mental illness, students with disabilities, or other intersections of identities like gender.
Right. And this is a very important question, because I didn't really get into like how like say poverty is related to a race, right, which is a huge connection. And those who like say work in the school system or work with kids know how the proportion of kids with disabilities who need help at school is hugely different, like say in suburban schools and in like say inner city schools, and for different populations, right? And so this is like a whole kind of like separate issue to get into, like how race and poverty and mental health conditions are related. But what I want to underscore is it's really important that when we look at the outcomes of providing these services to kids of different races, so I'm gonna share my screen to show this a graph from the National Center of Education Statistics that is done by part of the Department of Education. And so what we see here, that among students who were served under the Individual with Disabilities Act, who exited the school, the percentages for different races and ethnicities are not that different. And that is a very optimistic thing for me. That tells me that these services, these school-based services, they do a lot of good regardless of race and ethnicity. And so the outcomes are actually very equitable. So that's my optimistic kind of like take on this.
Yeah, that's awesome to see. We wanted to know, do you know if there's any research underway that's looking longitudinally, like lifespan length? You talked about your research being 3 years, 5 years, 7 years out.
Right.
But lifespan, about the impacts of psychotropic medications and or school-based supports. Do we know lifelong outcomes about children with developmental disabilities who have contact with the justice system? And compared to their typical peers, do they fare better, worse, the same? We don't know. More research is needed. Let me know if I need to repeat anything. That was a complicated question. Awesome questions coming through.
Right. Yeah, thank you. This is a very important question, and also a very difficult one to answer, exactly because I think tracking kids like over time and like say taking into account all these different things for each person can only be done again in countries with national registers and a kind of like laxer privacy laws, right? Like some Nordic countries, but also from all the research that I've seen, it's mostly done on either adults and they look at, like, for example, those who had childhood ADHD, right? Like say, how do they fare compared to those who didn't? And for the most part, ADHD is a very influential factor in terms of criminal justice outcomes. And it's that impulsive kind of like part of it that creates more opportunities for, like say, those who have either an untreated ADHD condition or whose ADHD condition is not under control in terms of medication or other options. that they have a hard time, like say, controlling their emotions, and that's usually emotions like anger and like say despair that can lead to some of the negative consequences in terms of violent behavior, aggressive behavior. And then another interesting study that I saw was conducted on adolescents who were, and that's a rare situation when we have adolescents who are at-risk kids who had a contact with the criminal justice system. And then the researchers were able to like say to do a joint project with the educational authorities to assign kids to, like say, school-based services, not all at once, but like say first a randomly selected group, then a year later another randomly selected group, so that we could see whether those school services make a difference. And unfortunately, that was a research by Sonia Senik and her colleagues, and unfortunately, it does not look like at that age for that group there was a difference. So that's a pessimistic outcome. But again, it's just one study. Like this is still an open question. There are still more studies that hopefully will be conducted. And again, the question in my mind, is it that it's too late? So like services should focus on the earlier ages, or is it that something else needs to be done in addition to school-based services for adolescents at risk?
Wow. Yeah, I can't wait to see what research comes out on this. We had an audience question. Is there anything that speaks to race and misdiagnosis? So again, getting back to that concern of either overdiagnosis or incorrect diagnosis, for example, for conduct disorder versus depression, specifically in youth of color.
Right. Yeah, that is a very that's a very important question, and we know from healthcare research that people of color are often either their complaints are not taken as seriously, or the attention of doctors and medical personnel to their like say symptoms is different. And this is an unfortunate reality, and I'm sure it also kind of translates to the younger ages as well. And so the question in my mind, do we have a problem with misdiagnosis that is especially applicable to children of color? Or is it more important to focus on the fact that maybe not all of them have access to the proper care, to the proper diagnoses? And I know that in a lot of parts of the United States, especially in more rural areas of the United States, access to psychiatrists, especially child psychiatrists, but even to pediatricians, is extremely limited, and that can also affect like say how children from different racial groups are diagnosed.
Okay. So we're getting a lot of questions, and a couple people.
Thank you so much, by the way. Thank you everybody who is asking questions. I really appreciate it. This is such a fascinating conversation. I absolutely love it that you are so responsive.
Yeah. So the question is about getting more interventions and services. So people are asking about modalities that can be used in different settings. So schools, justice settings for kids who are not in school. Are there resources or websites that you recommend people look at for access to learn more about what services are available for youth with disabilities?
Yeah, that is an excellent question. And I hope that some of our audience members actually have a better answer than I do, because I assume that these services are very localized. And so what is available like in New York State, or what is available in one area, may not be available in another area. And I expect that these are not the services that can be done remotely. So they need to be administered locally. And so that is where I see a lot of the connection between, like, say, research and different policy implications that, if we know that certain things are important, we can put more resources into providing local, wraparound services for these types of kids. And you mentioned those who got, those children who are out of school. I think that is a huge issue, and also a problem that is very, very different for different races and ethnicities, because a group of PhD students under my guidance conducted a study where we were looking at comparing different towns in Connecticut in terms of school expulsion, percent of students that were expelled or suspended, and various other aspects of, the town well-being, right? From the average salary to unemployment rates to the racial composition of the town to child poverty rates. And it turns out that these are essentially impossible to separate. They are all tangled up. Those towns that have more problems in terms of unemployment, in terms of poverty, in terms of, educational level, average educational level of the population, those are also the towns that have more kids expelled and suspended, and clearly that they are the ones that need more help. And so I feel like resources should also be directed towards those places that need more help based on these data.
Yeah, the confluence of all of the social dynamics that come into it that require those additional services there.
Right.
The next question we have goes back a question or so. So we wanted to know if there's a role of destigmatization in seeking mental health supports and how that plays a role in the increased levels of mental illness, mental health being reported in this young adult population. And there's a question about, is it possibly that there's a change in the label that facilitates the receiving of services?
Right. No, this is a very important aspect. This is an excellent question. And if we think about how this was perceived, say 20 or 30 years ago, right? It was there was more stigma attached to mental health. And I feel that as time goes on, and maybe because of more kids are diagnosed, more kids are provided with services, now the thinking is shifting. Say before, it could be something shameful to, seek a diagnosis for your kid and, get them potentially exposed to others learning about this. And now it's a situation where it's seen more as a medical condition that needs treatment, that needs additional resources. Parents see it as something that can help them get more resources for their kids at school, can help them get additional services provided to their child. And I think that is a very important again, a general consequence of these trends that I was showing: increased increased medication rates and increased services, school-based services for children with learning disabilities. I think this is an important almost like a positive side effect that is happening, is that improvement in the general view, right? Those of you who can think to say 20, 30 years ago, there was a lot of stigma attached to even going to a psychologist, right? A therapist, and bringing problems and to discuss with a therapist. And now it's considered to be a standard thing. Most people do it, and it's not anything to feel ashamed of.
Yeah, it's again going back to that inclusion elements that you talked about in the presentation.
Right.
So related to this, there's a question: are you, or is anybody in the audience, feel free to put it in chat if you are aware of ways or models to effectively introduce therapy, the idea of going to a therapist and seeking these supports, to participants or parents who might be resistant or might still having grown up 20, 30 years ago, may still feel some of that stigma or shame. How do we break down those barriers?
Yeah, that's an excellent question, and I would welcome ideas from the audience. Maybe you guys can put your ideas in the chat, because I would love to hear your thoughts on this issue. My sense is that like, first of all, results of research show clearly that psychotropic medication works best in conjunction with therapy, in conjunction with psychological services for children and families, right? But the reason why I couldn't include it as part of my research is because we do not have data on that. We do not have data for each state, like, say, what percentage of children or families actually receive those therapy services. And so I think it's a really important consideration that even if we think, like, say, positively about psychotropic medication, and again, I am sure it's a very controversial issue where some people would feel like, we shouldn't drug kids, and other people feel like it makes a huge difference in the child's behavior and the life of a family. I think that idea of supplementing medication with therapy, it's hugely important, and I think you mentioned like a very important aspect of, like, how do we make it even less stigmatizing, make it even more acceptable for people to seek psychological services.
One audience member says, not using the word therapy, sharing as someone who can help you feel better, somebody who can help you improve in academics, help you improve family values, may be a way of making that more accessible. Thank you. Please continue putting your ideas in chat to share with one another who are here today. The next question we have, and possibly the final question, depending, some of the trends that you have shared in the data that you talked about in the early part of the presentation are pre-pandemic, so some of them are pretty dated. Are there more recent data that show these patterns holding or changing? And is there anything specifically about crime rates that are more recent?
Yeah, that is a very important question. And what I'm going to do is I'm going to show the data that I prepared for if it comes up about the pandemic situation. What happened during the pandemic is we had a change in terms of like, say, I showed you the violent crime trends, right? And these crime trends continued through the pandemic and after the pandemic. At the same time, for homicide trends, we have a huge increase. It's not as huge as to reach into the levels we had in the early 1990s, but it's pretty huge compared to the recent fairly low rates of homicide. And it happened during the pandemic, and they are coming down, but not quickly enough. And what I thought would be really important to mention is, just like in the early 1990s, we had a huge increase in gun homicides, especially for the age that we are kind of focusing on. In this case, victims age 12 to 17. There was a huge increase in firearm homicides, and we are seeing the same exact increase during the pandemic. The most of the homicide increase was because of these gun homicides, and there is an increasing rate of firearm ownership, and increasing number of guns owned by people in this country. And unfortunately, this is inevitable that it makes a difference and leads to more lethal violence.
We have time for one final question. And so somebody asked if you could clarify if you're talking about children with developmental disabilities and or emotional regulation issues and or a psych diagnosis. Are developmental disorders being combined with diagnoses such as bipolar or oppositional defiant disorders?
Right. Yeah, no, that's a good question. And that is kind of like getting into the weeds, right? Like, what are we including when we are, like, say, talking about mental health issues, right? Are we including only major psychiatric disorders? Are we also including things like anxiety and like, say, subclinical depression? So it's important for definitions, right? But if we look at trends, they are very similar, whether we are only looking at official diagnoses and major disorders, psychiatric disorders, or whether we include things like just like a child feeling like despair or sadness or anxiety.
Thank you. That's a very helpful clarification. And Maria, thank you so much for the conversation today. I would like to thank you on behalf of the YJI and everybody in attendance today for taking the time to share this incredibly important information and have a wonderful conversation with all of us. Before I get to closing announcements, I'll pass it back to you for your last thoughts.
Thank you, Alicia. And again, thank you to everybody on the Youth Justice Institute team. You guys are amazing. I'm really grateful for this opportunity. And thank you to the audience for attending this talk. I also want to say that my probably main takeaway that I want you to think about is that if we take the bird's eye view and look at things, you know, like kind of like the bigger scope of things, we can see how much difference like, say, legislative changes make, how much difference policies and like, say, directing attention to the right resources, how much difference it makes. And I think that is something that's very important to keep in mind and to kind of like fight for.
Thank you so much. In a moment here, we will launch a poll question asking our audience how much you agree or disagree with the statements. The webinar was informative and the webinar was engaging. Please answer these questions so we know how today's webinar went for you. While everyone is answering that question, I have a few announcements and items to put on everyone's radar. The next YGI Lunch and Learn webinar session will be held on December 19th at 12 p.m. Eastern with Dr. Natasha Slesnik, who's a professor and associate dean for research in the Department of Human Sciences at The Ohio State University. Dr. Slesnik will present on housing as prevention for youth experiencing homelessness. Immediately following this webinar, we will send you a survey to you via email. Please complete the survey as it allows you to provide further feedback and questions for us. This information is also used to improve future webinar sessions. It should take no longer than 5 minutes, and it is now also a link in the chat. Finally, if you've not already done so, please feel free to connect with us on Facebook, Instagram, Twitter, and LinkedIn. The links to these accounts can be found on our website. Just a reminder that the views expressed here are those of the presenter and do not necessarily reflect the views of the New York State Youth Justice Institute. In closing, I want to thank you all for taking part in this session of the YGI Lunch and Learn series. We hope that you've gained something from this webinar and that you'll continue to think about what Dr. Tcherni-Buzzeo has presented today. We look forward to seeing you at future YGI events.